GAVI model of public-private partnership and taking things to scale is very relevant to outbreak situations. We're already trying to bring measles and rubella vaccines across the world, meningitis A vaccines to the meningitis belt, Ebola vaccines to prepare stockpiles for future outbreaks. And of course, as new agents appear, we want to work on making sure those will be available as well. One of the things that we're also paying attention to is how new technology can move forward and accelerate the creation of vaccines that are either appropriate to use in emergencies or faster in creating those vaccines. So for Ebola, we were able to move from vaccines that had been created but not tested in humans through phase 3 testing in 1 year. Obviously, if we prepared ahead of time and had the types of delivery systems available and have those proved and had a way to do the research on them, we could move very quickly to having those rolled out in the case of a new disease outbreak, and this would be ideal. So one of the things that's true about the world today is how it has come together in one globalized society. Viruses move and peoples move. So when you have an outbreak in one place of the world, controlling it is critical because otherwise those viruses will move, like we saw with Ebola, which ultimately spread to multiple continents. So we need to have a different view. We need to think of it as global health security, not local health security. So vaccine hesitancy is a global problem, and it relates mostly to the fact that people have forgotten how severe these diseases are. In the countries where we work, in the poorest developing countries, people want to have their children immunized because they've seen cousins, people in the villages, others die from these diseases. Here we get complacent and we let our suspicions get away with us, and we stop vaccinating our children until the susceptibles rise to a level or there's an import of the disease, and then we see an explosive epidemic. That's occurred now all across the world, for example, with measles. We need to stop that. We need to protect children everywhere so that they can live to their full potential and not cause epidemics that can affect not only other children, but children who, of course, have immune systems that are too weak to fight these infections themselves.